Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and we have Dr. Tanner with us here today, and he has been having some increased muscle hypertonicity in his mid to lower thoracic spine, upper lumbar spine region. So today I'm going to show you what we do for some of these patients that have that severe of a tightness or muscle spasm in those regions. We use this Blue Emu Extra Strength topical cream that is a muscle analgesic. It does not smell like BioPhysics or Bengay or any of those other topical lotions that you put on, and it does not stain clothes either, so we like using that. So we feel the patient's spine starting right down in the pocket here at the quadratus lumborum multifidus, and we work all the way up the paraspinal muscles, and see, he's starting to get real tight about right now. Does that feel tighter to you, Dr. Tanner?
Yes, it does.
So see, I'm putting some fairly deep, steady pressure in there. Now that was real sore right there on the right. All the way up into there. Okay, so then if I do that too much with my thumbs, they start looking like pancake flippers, so I'm going to use my elbow, and I'm going to do the same thing on each side. You probably feel this one a lot more, huh?
Yes.
Yeah. Now this is a very, very deep soft tissue technique that works very well. Boy, that's really tender right there too. There. A lot of patients get the old white knuckle syndrome on this when they hang onto the table, legs a little tighter. But you just want to have them continue to breathe through this. You don't want to ever want patients holding their breath. That's real sore right there too, huh, Dr. Tanner?
Yes.
Alright, so, and you notice I always start from the bottom and work my way up instead of starting at the top and working my way down. Those of you who went to Palmer College of Chiropractic in Davenport, Iowa, or any of the other two campuses at Palmer, probably know this technique as Nemo. Not like Nemo the crazy submarine captain, but the guy's name was Nemo. Nemo, a lot of people call it Nemo, to I-N-M-M-O technique. And it's, when I was doing this with a fellow chiropractor of mine when I was going to Palmer in a postgraduate education program that Palmer put on, which is right there on the campus, I felt better than I ever have in my entire life, and I was around 20 at the time. I've been in martial arts since I was 13, so I had a lot of issues in my spine from the trauma that I had sustained in tournaments and fighting, and a couple accidents. Boy, that felt pretty deep, huh, Doc?
Yes, it did.
Yep. Okay, so we have now worked on his muscles there, and now I'm going to adjust his spine. I'm not decompressing him today. We do that on occasion with him. His right leg is coming up about 1/4 of an inch short today. It gets even when I bring it up, so that's called a positive knockless test and Deerfield, because his low back and pelvis raised up near and got tighter, and then also the leg got even when I brought it up. That's a positive Deerfield test on the right. That indicates a sacroiliac subluxation, which is right down here on this right side, which I'm adjusting right now. The sacroiliac joint runs at a oblique angle where the sacrum, or the middle triangular shaped bone, meets the right ilium, or the big pelvic bone over here, therefore called the sacroiliac joint. There we go. Now I'm adjusting his sacrum straight superior to inferior, on both sides, the right side up here and the left side here. And then the left SI joint, which is not out as much as the right one, but you can feel that joint slide through that 45-degree oblique angle. Now he's got a loss of the normal lumbar lordosis, or the curve in the lumbar spine from the side view. So you notice I adjust him always when he's exhaling. So you want to just have the patient continue to breathe normally. I don't have them take deep, big breaths. I just have them breathe normal, and I feel when they're relaxed, and that's when I hit them. And you'll notice the angle on my arm changing the further up the lumbar spine I get. Right there's L3, L2, and then I'm going to adjust this area. Yeah, keep and go. That's it. There we go. That was T12, L1. There we go. Okay, try that one again. Just breathe easy for me there now. And exhale. Okay. He's super tight, and a lot of times when you work on these muscles like that, it'll tighten them up so you won't hear the cavitation as much, but you can still move the vertebra in the joint plane. Whew. Alright. Okay, I'm going to put your head down just a little bit to open those joints up. There you go. Yep. Okay, don't hold your breath on me. There we go. This is the tightest I've seen you in a long time. We also talked about him earlier before we started the video about using a foam roll at home or a couple of tennis balls to put right in the area of the paraspinals here. And you can see his lumbar spine's flattened out. It doesn't have the normal forward lordosis in here. So what I'm doing with this now is just increasing the circulation in the tissues. Besides that, feels pretty good, huh, Doc?
Yes, it does.
A lot better than my elbow, huh? So those of you who have ever had any real deep tissue work from either a massage therapist or a chiropractor, or even a physical therapist for that matter, know that the elbow, when you get down deep in there, is probably one of the very best ways to break up what's called trigger points or myofascial pain syndrome problems. There we go. That should feel a little bit easier already.
It does.
Okay, good. Let's turn you on your back now. Now we've run the appropriate orthopedic neurological tests on him, vascular test to make sure he's not a candidate for stroke. There we go. That was the C5-6 on the left. There's C5-6 on the right, which he has had in the past, not so much today, but in the past had lower cervical problems at that level. Good, there we go. Now, just relax your leg right in my hands here. There we go, okay. Okay, let this one all relax. There you go. There you go, good. Okay, there we go. Let's have you sit up, face towards your knee there. Good. Okay, let's scoot you back this way. Does that hurt down there now when we raise your arm up, like you said?
No, sir.
Okay, good. So before, when he came in, he had had pain when he raised his arms up right down in his mid to lower thoracic region. And is that hurting on this side now?
No, I'm a new baby.
Okay, good. Dr. Tanner was nice enough to leave us a wonderful 5-star review on Google, which you can read just by Googling best chiropractor in Houston. We'll be the first ones to pop up on the page.
And you deserve 10 stars instead of 5.
Oh, thank you very much. There we go.
You are truly the instrument of God.
Well,
Thank you.
thank you.
Thank you.
Would you mind sharing with our YouTube subscribers and viewers what brought you here and how this is done for you and what you're doing now?
Well, I tell you, I was in such pain I couldn't get around, and I come to you, and every time I come, I leave feeling so much better. And
And now you're really only coming on an as-needed basis, really.
That's true.
Yeah.
But
At first we were off a little bit more frequent. Now it's cut down. You
But
come
it's
in when you want
wonderful
to.
to know where there's help. I
Yes.
can tell you that. It's wonderful to know, Doctor.
And you hadn't had chiropractic care ever in your life until
Never,
you
and
were about 75.
I was too dumb and too old
Oh,
to
wow.
wait, but I'm glad to know you now. Thank you.
Yes, you're quite welcome. Don't let him fool you. He's not dumb.
Thank you so
He's
much.
Professor Emeritus for UT Health University, right?
Yes.
So anyway, this is your Houston chiropractor coming to you from Houston, Texas. We'll see you next time.